During the transition phase of labor, a client complains of tingling and numbness in her fingers and tells the nurse that she feels like she is going to pass out. What action should the nurse take? A. Encourage her to pant between contractions and blow with contractions. B. Coach her to take a deep cleansing breath and then refocus. C. Instruct her to pant 3 times and then exhale through pursed lips. D. Have her cup both hands over her nose and mouth while breathing. Correct answers: white heavy checkmark D. Have her cup both hands over her nose and mouth while breathing. The nurse observes that an antepartum client who is on bed rest for preterm labor is eating ice rather than the food on her breakfast tray. The client states that she has a craving for ice and then feels too full to eat anything else. Which is the best response by the nurse? A. Remove all ice from the client's room. B. Ask the client what food she might consider eating. C. Remind the client that what she eats affects her baby. D. Notify the healthcare provider. Correct answers: white heavy checkmark D. Notify the healthcare provider. The nurse is teaching care of the newborn to a childbirth preparation class and describes the need for administering antibiotic ointment into the eyes of the newborn. An expectant father asks, what type of disease causes infections in babies that can be prevented by using this ointment? Which response by the nurse is accurate? A. Herpes. B. Trichomonas. C. Gonorrhea. D. Syphilis. Correct answers: white heavy checkmark C. Gonorrhea. The client comes to the hospital assuming she is in labor. Which assessment findings by the nurse would indicate that the client is in true labor? Select all that apply. A. Pain in the lower back,